Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hello, so in this video, we're going to go through the talking therapy skill station for mental health OSCE. So this is an 8-minute station. So as always, I would recommend you look through the marking criteria before you go ahead and do this station in the exam. It just gives you an overview of what you need to do and of course what that examiner needs to mark you with to pass you, most importantly. So let's have a look at it now to go together. So introduce yourself, quite straightforward. ID's the patient. So remember name and date of birth and check that against your documents you're provided with. So you will be given a brief scenario and you'll also be given a PHQ questionnaire. We will be making another video at some point soon with going through a PHQ questionnaire. Okay, so this should most likely be completely pre-filled for you with the totals done. If it's not done, completely pre-filled, it will be already the patient has answered the questions and given the scores and you just need to total it. So it shouldn't take long at all. Obviously, please review this document before your exam. So on the back of the PHQ document, you will see some recommendations based on the patient's score. So if they are scoring more than 10, it does recommend psychotherapy. So you can choose that option for the patient if they are scoring more than 10, or you can also choose the other options of therapy depending on what you feel is best appropriate. So let's go through the rest of the marking criteria. So obviously number 3, gains consent to continue the visit. So just to explain to the patient what you're doing. So in this station, you're not actually doing the talking therapies, you're just explaining what they are and making a recommendation for what it would be the best one for the patient. So Anne, today we're just going to have a little chat. I'm going to explain to you different kind of talking therapies and we're going to see if there's one that would best help you. Point 4, body language is clear and you are relaxed. Obviously, I know you're going to be nervous in the exam, but remember this is a mental health patient we are dealing with, so just try and be relaxed and open. Don't have your arms folded or anything. Try and make sure you maintain eye contact with them, that you're smiling. Obviously not if they tell you any bad news, but just try and be positive as you can with it. Okay, next point is discuss the reason of referral, the PHQ. So you can say, Anne, I've been asked to do this referral for you for talking therapies today because your PHQ results. So that is the questionnaire you've done. Yes, something along those lines, quite straightforward. Okay, so point 6, listen and acknowledges the person's feelings, showing empathy. So ask the patient if they want to tell you a little bit about what's going on, and then obviously you need to act appropriately. Oh, I'm sorry this happened. I understand you're feeling down. Just obviously behave appropriately with that one. Next, you're going to go through some of the benefits of therapy. So they are all listed in the marking criteria, so just chat through some of them. So Anne, so we would really like to recommend you with the talk for some kind of talking therapy. It should really help. Often people find it beneficial to talk to someone different who isn't, for example, a family member or a friend, and also gives you time with someone who's trained to do everything. If you need to cry or anything like that, you know, the other person who's doing the therapy will be able to give you a different viewpoint and maybe help you make decisions and that kind of thing and sort of guide you a little bit. Obviously the overall aim is to hopefully make you feel a little bit more positive. It's not going to make the problems go away, we know that, but hopefully it should help you feel a bit stronger to deal with them in a better manner. Okay, for the next one, the point 8 on the marking criteria, you're going to run through all of the talking therapies there that are listed and just briefly explain them. So the ones we have is counselling, CBT, interpersonal therapy, psychotherapy, and mindfulness. So I'm going to go through and explain them now, but no need to explain in too much detail to your patient. Just a little brief explanation because you've only got 8 minutes, remember, and you don't want to be rushing your patient. Okay, so counselling, this involves a trained therapist listening to you and helping you find ways to deal with your emotional issues. CBT, or cognitive behaviour therapy, helps patients to manage their problems by changing the ways they think and behave. Interpersonal therapy is all to do with the patient who have problems with their family members, for example, relationship issues. So if you have a scenario, something like that, I don't know, maybe they have a problem with their mother or something like that, you can definitely recommend that one. Psychotherapy is a talking therapy that helps people with a broad variety of mental illnesses and emotional difficulties. Mindfulness-based therapies have an intense focus on the person's thoughts and feelings. So if they're struggling with how they feel about themselves and that kind of thing, very negative, that would be a good one to recommend for that patient. Okay, next point on the marking criteria, you're going to recommend whichever therapy and give a rationale to why. So I've just given you a few examples of that. So just explain to the patient. So I'm going to recommend a mindfulness therapy for you because I noticed you're saying you're struggling, about the way you feel since you've gained weight, and I feel that will be really beneficial, that one. Okay, recaps the areas discussed before the end of the visit. So just run through whatever the patient has told you about, just briefly cover that off again, and then say thank you for your time and sort of wrap it up. Okay, so Anne, thank you for your time today. I really appreciate you opening up to me about the issues you've been having recently, and then just talk about whatever they are. So I'm going to recommend you for this kind of therapy, whichever one it is, and I'm going to do a referral for that. Do you have any questions for me? Okay, so that's part of the marking criteria again. Ask the patient if they have any questions. Okay, that's fine then, Anne. I'm going to go and do my paperwork now. Are you comfortable? Yep, that's great. Okay, and that's the end of your station. And as always, good luck with your exam.